Also remember, there's a few risk factors that involve the cause of high blood pressure. Example, family history, stress, lack of physical activity, exercise, etc., alcohol abuse, and tobacco smoking. These are also things which we have to try and cut out or just make a little bit changes to it. Also remember, lifestyle also has an effect, right? Especially our nutrition and our diet. And then remember also we said there is no symptoms. That's why we call high blood pressure a silent killer. Yes, that's true. But if you experience certain conditions, example, dizziness, you feel faint all the time, headaches, and sometimes you have shortness of breath, sometimes you have chest pains, sometimes you even have nose bleedings. Please, these are signs. Don't ignore them, especially if you get them most of the time or frequently, right? I'm not saying if you get them once in a blue moon, but if you get them regularly, then you must also make sure that you go and see your physician. Go and see your physician or go to a doctor. Just let them check you out, because these are signs which shouldn't be ignored. Because I know most of the time people always say, you know what, I always get this disease spells. And I'm thinking, disease spells? And I always ask, how frequently? No, I get it almost all the time. Then I always used to tell the people, but go and have your blood pressure checked. No, man, it's nothing. It just happened for a few seconds or for a minute or two, and then it's over. Duh, be careful. That is a sign. Don't ignore it. It's a sign that's there. And headaches all the time. Only thing people do, now give me a grandpa or give me a tablet. People, don't ignore it. I know when you drink a grandpa or when you drink a painkiller for it helps. But that doesn't mean there isn't a problem. Go and have your blood pressure checked. It's important. I even get it with nose bleeding. When people's noses started bleeding just for nothing. And when you ask them, how often do you get it? No, I get it all the time, but it's normal. No, there's nothing normal in your nose just bleeding. There is trouble. Remember, where there's a smoke, there's a fire. So why not go and have it checked out? Don't ignore it, because as time goes on, it gets worse and worse and worse. And before you know it, it's too late. There's a saying that goes, don't wait till it's late. Have it checked now, sort it out now. I don't believe in the thing where they say, rather late than never. To me, rather late than never doesn't work. Rather late is already late. There's a sign. There's smoke, so there will be a fire. Please, have it checked out. And get to the root cause, and then go for the appropriate treatment.